Not too bad. It was a cool morning this morning and kind of rainy all day, but not too bad now. The sun's actually out, so
We just got done with 3 days of rain here. So,
nice. Remind me where you're at?
Milwaukee.
Milwaukee, that's right. Very cool. All right. So yeah, we're ready to go. Kind of same thing as before. You've got me here and then got just a few guys in the audience here that are ready to hear you.
Okay, and this is still the supervisor group, correct?
Yes, that's correct.
Okay, perfect. Ready then?
Yep, on you.
Okay, perfect. Welcome, good evening. My name is Brian Scornia. I am working with Ready Rebound now, giving these presentations and explaining what Ready Rebound is and how to use us. I am a recently retired um, detective sergeant with the Wauwatosa Police Department. It's a suburban department of Milwaukee. We're pretty busy seeing the overflow of Milwaukee, but after 30 years, I was ready to move on. Um, this program, Ready Rebound, is all about sports medicine. It's bringing sports medicine to our injured police and firefighters. The same as a professional athlete gets treated when they're injured, we bring that same sports medicine approach to our injured cops. Um, in my role as a detective sergeant, we have this program obviously in our police, fire, and DPW departments. I was able to experience and use this program on two occasions personally, for a shoulder injury, which I did need surgery on, and a knee injury that just needed physical therapy. And being treated the same as a professional athlete was treated, with getting in and seen promptly, quickly, within hours and days, was amazing feeling for me to use this program. I was also to see my detectives use it and be able to save their own personal time and getting back to work and getting back to what they want to do quicker. So I have firsthand knowledge using this program and then seeing it as a supervisor as well. I'll go through the entire what we're all about. We have been part of your department already for some time now. I know I gave this presentation in October to hopefully everyone that's already in this room. So this will just be a refresher of what we're all about and how to use us. Ready Rebound started with Luis Rivera. He is a physical therapist by trade and worked in his school, and he worked with the college athletes of Arizona State and the professional athletes of PGA and Major League Baseball. So he was able to experience firsthand the value of getting these injured athletes diagnosed and a definitive diagnosis of what their injury is and what the path that they needed to take to get back to health. That's what sports medicine is, identifying it quickly and getting them back onto the field. Um, there was obviously incentive for them to be on the field, either be it scholarship or professional program. And when he came to Milwaukee and opened up his physical therapy clinic, he started working with Milwaukee firefighters, and he was shocked to see these injured firefighters with just wasted time at the beginning of their injuries where nothing was being done. They were either on a sideline just resting or waiting for the next appointment. And that was unacceptable to him. So that he started our program, and it has now evolved. We are in 19 states. Again, we are already established and part of your department. So we're continuing to grow. And our entire focus throughout this entire process of you being hurt and getting back to health is to take care of you throughout this process. And you'll see that throughout here. So again, the professional athletes, they have a network, the team of doctors, specialists, physical therapists, either at their games or on instant standby to get in and seen quickly if they're injured. We bring that same care to our injured police and firefighters. So we have the network set up in your area that we are able to contact the specialist, either by that specialist personally or that nurse of that provider, and get in and seen promptly. So when you call us, we're going to set up and get our people in quickly and promptly and get that expedited quality care to you. we're going to send you, obviously, we're going to figure out what your injury is, triage it, figure out what you have, and get you in to the best possible person. If it's a shoulder injury, we're sending you to a shoulder doctor, knee injury, to a knee doctor specialist. We're not just going to get you in and seen, we're going to get you seen by the right person. This chart here actually, it may not be up on the computer, but I've got a chart here that shows the what we're used to when we're injured before Ready Rebound program started. So if you're injured, and we're all aware of this, you get it taken care of at the urgent clinic or ER, and then your follow-up is scheduled for your primary care doctor. Well, you got to wait a couple days to get in to see them. You follow up with them. They prescribe rest or physical therapy. Maybe they don't know exactly the extent of the injury or how to care for it. You finally get referred to orthopedic specialist. The good ones have a busy schedule, so it takes time to get in to see them. So there's a bunch of wasted time at the beginning of your injury where you're not even sure what is wrong with you. All they're prescribing is rest or physical therapy, and nothing is being done. You finally get in to see an orthopedic specialist, and they prescribe the MRI to get a definitive diagnosis of what your injury is. Well, there's a whole bunch, again, it's just wasted time at the beginning of your injury. Calling us if it's a workers' comp injury, obviously you got to care for you care for it the same way with an urgent care visit or emergency room. And then your ability, if you're aware of our program, call us. It's voluntary. It's not mandated to use us, but I highly encourage you to at least use us as a resource and to use us to get back to health. If you get that workers' comp injury, you get that referral number, claim number from your department. This program can also be used off duty or family members. I'll get into that here. And then we can work with that primary care provider that is your personal provider. Calling us, you're going to get in and seen promptly. Our goal, and we're going to continue to strive to do it, is to get you in within 24 to 48 hours to the proper quality, high quality specialist. So within 24 to 48 hours, you're going to have the appointment to be seen. Within 72 hours of your injury, you're going to have that MRI done. So there is a definitive diagnosis of what your injury is and the correct path and plan of what needs to be done for you to get back to health is there. If it's surgery, it's scheduled and it's quickly done. If it's physical therapy, we set you up with a physical therapist. That physical therapist is probably going to be close to your work or home so that there's not a lot of drive time involved. But we want to partner you up and work with you and your schedule to get you seen by the right people. Again, if you're able to get in and seen and get a definitive diagnosis of what your injury is and what the path is to get back to health, we're able to get that injury and get you back to work quicker and save essentially 3 months at the end of the recovery, because we're taking out that wasted time again at the beginning of your injury where you're just waiting and nothing is being done. As supervisors, you're going to be the ones that are going to be notified of your people being injured. So given this refresher course to you as a reminder to share with them that this is an option for them is valuable. When you call us, your phone call is going to be answered by a licensed athletic trainer. All of our navigators, trainers are or have been, they're qualified to be on the sideline of college or professional teams. There's a slide up here where we show all of the pro teams, college teams that we do work with. So when you call and talk to our navigator, you're speaking to somebody that knows and has experience of what your injury is. They understand it. They'll ask questions, triage your injury so that they can get you seen promptly by the right person, where your location is, where you live, what doctors are in that immediate area, so that we can get you in and seen quickly. Again, that navigator is there to work with the injured, our injured member and get them back to work quicker. So our entire focus is essentially a concierge VIP kind of service, and we work and partner with that injured officer member to get them back and take care of their needs. So what they do is they'll answer the phone. You call us, we're going to answer the phone 24/7, 365, figure out what your injury is, figure out what your schedule needs are, set up that appointment, and then we'll follow up with you after those appointments. We'll make sure everything is going right. If it's not, we're able to identify it quickly because we're following up with you after all these appointments. We may even follow up with you from appointment in between appointments to make sure you are doing well. Again, it's a relationship that we build with you and make sure that everything is focused around you and getting you back to health. For workers' comp injuries, our navigators will share what the restrictions or what the details are off of those doctor visits with the appropriate stakeholders, be that the department or the insurance carrier, to make sure everybody is on the same page and that everything is everybody's functioning in the right order. They're also working on your behalf to make sure if you do get a bill for a workers' comp injury, that you partner with them. They are able to work with the insurance carrier, make sure that that's not appropriate, that bill is taken care of. If this is an off-duty injury, we'll work with, we do not share any of the information. We count it as a courtesy visit. We do report courtesy uses of our program to the city so that they're aware that our members are using it, but we comply with HIPAA and we do not share vital information. Just for those workers' comp injury claims, we do share what restrictions are, and so that everybody's on the same page. Our providers, our specialists that we work with, again, we go right to them. We do not go through scheduling departments. We go right to that provider or that provider's nurse to access the openings in their schedule to get our people in seen promptly. I've seen time after time where this program was called, or we were called at like 9 o'clock in the morning, and our member had an appointment at noon or 1 o'clock even. So our goal is to get our people in and seen promptly. We're going to strive to continue to do that because that's where the value is, again, of accessing our providers and getting our people in and seen promptly. We also provide training for our providers. This builds relationships with the department and the providers. So what we'll do is we'll do a police for a day or a firefighter for a day training where we'll bring our providers in. They'll get to see and experience the exact equipment that you are using in the different roles and assignments that our officers have so that they can curtail and finely tune the physical therapy program so that when you come back off of your injury, you're even better than you were when beforehand. This program, again, is for workers' comp injuries. It's also for off-duty injuries and family members. Also, your professional staff and retired members are able to use it. There is value if you're on a workers' comp injury, you're going to be off on duty time. If it's an off-duty injury, you need to take your own personal sick time or vacation time or PTO or whatever it is there so there's value of you using us so that you use less time to get back to health and you're able to be back to who you are. If it is one of these, we just need to identify who your personal insurance carrier is and then work within the restrictions of that program. All of our doctors will be, for the most part, they're going to be in network. We're going to make sure of that they're in network to your program, and we'll work with you throughout this entire process again to make sure that everything works well for you. To use us, you can use us one of two ways, either calling an 800 number that I'll provide here, or use us on readyrebound.com through the internet. This is the face page I got here, top right, get in touch, and you just click through, it forwards you to an injury report form where it asks simple pedigree information just to get you in, and contact information where we will call you back promptly and get you seen as soon as possible. I'm going to leave up a QR code on the screen if it is able to be seen by you so that you could use this and enter our number in. But I believe this should be posted throughout or available easily to you as members. Again, our entire program is all about taking care of the injured officer, getting them in and seen promptly to the best high quality care provider that we can access, and to walk you through and help you through the entire recovery process. Use us as a resource, please. All of the people that you're talking to are, again, they're athletic trainers. They know what they're talking about. They have experience in recovering and dealing with injuries. You can use us for an existing injury if so be it. Uh, you're not happy with the way your recovery is going off of an injury before, and you're able to use us either as a second opinion or whatever. You just need some advice or information. Please, it's a 800 call. It's worth it. If you have any questions, I will answer them now, and I will answer as honestly as I possibly can. So,
Awesome. Thanks,
Sergeant.
Brian. Yeah, we can see that totally fine. So that's perfect. Um, it doesn't look like nobody has any questions. I know after our presentation the other morning, a couple guys shared how beneficial it was for them. So that those have been some kind of good stories to share around of how they got very quick response and it helped speed things up really well. So
Perfect.
it sounds like there's some folks using it, and I mean, unfortunately, they're having to use it because they're injured, but they're getting some good results from it. It sounds like so.
Yes, that's awesome to hear. And again, yeah, you're right. Hopefully nobody has to use it, but if you do, if you are injured, it's an amazing resource and a program already established for your people.
Awesome. I know when you came out before and gave the presentations and everything, is there a link for this, or am I able to get a link for this recording at all or anything to share with any of the supervisors that couldn't come today? I usually send out a kind of a follow-up.
Yes, I will follow up with you and get that to you through your email.
Okay, perfect.
Okay?
Yeah, I think we're good then. I don't see any questions.
All right. Thanks, Sergeant. Have a good night. Stay safe.
All right, thanks, Brian. Appreciate your time.
Bye-bye.
Bye.